Well, as parents wait for their chance to get their kids the Pfizer vaccine for COVID, there are a lot of questions after today's FDA panel vote.
Joining us now is Dr. Tina Tan, an infectious disease specialist at Lurie Children's Hospital, to try to answer some of those questions and concerns for us. Doctor, thanks for being with us.
Oh, my pleasure.
Well, it is a little concerning, right, to think about injecting something so new into a child as young as 5. So what do you say to parents who are nervous about the vaccine?
Well, we know that this vaccine has been tested in a number of children and that it is safe and effective. And that the dose of the vaccine that's going to be given to kids 5 to 11 years of age is actually a smaller dose than the dose that's given to kids over 12. So I think, just looking at the data that has already been generated, we know that this vaccine is safe and effective.
All right. So the governor had a press conference yesterday where he talked about this rollout. He said there would be about 500,000 vaccines issued to pediatricians and pharmacies as soon as it is approved. Do those numbers seem reasonable to you, meaning that will be enough to cover some of the need here in Illinois initially?
Maybe in Illinois, but we know that there are around 28 million children between the age of 5 and 11 here in the United States. So yes, in Illinois, that may be an adequate amount of vaccine, but for the entire United States, we're going to need, obviously more doses than that.
Do we know what kids should expect? I know it's hard to predict because, goodness, just the adults we talked to all had kind of different reactions to getting the vaccine.
So the reactions that we're seeing during the trials were actually quite similar to what we're seeing in the adult population, but in general, they tended to be milder, with maybe low-grade fever, a sore arm, and maybe tiredness being the most common reactions that were noticed in the trials.
I know that a lot of the pediatricians are receiving calls from parents right now. As you talk to some of them, some of the doctors, the pediatricians, what are they telling you is the biggest concern? Is the biggest concern sort of a long-term impact of the vaccine, or just short-term some of the effects, the side effects?
It's a combination. I mean, parents are worried about the potential side effects of the vaccine when their child gets it, because, if a child develops a fever or is not feeling well and needs to stay home from school or daycare, they need to find someone to take care of these children. But they're also concerned about what happens in the long term and will they need another vaccine? And these are issues that I think we just need to see what plays out. But looking at the information that we have in adults, we know that there really are not a lot of long-term side effects associated with these vaccines.
And what if we see a lot of vaccine hesitancy among parents and we just don't see a lot of younger kids getting the shot?
Yeah, I mean, vaccine hesitancy is always there. We see it with the routine vaccinations that we give. We know that COVID vaccines are really the only way that we're going to be able to control this pandemic and to provide some protection against the Delta variant and other variants that may be circulating. And I think, physicians need to talk to the parents and explain to them the different facts about COVID and the facts about the vaccine, and really show them the information that this vaccine is safe and effective.
All right. Thank you so much for your insight, Dr. Tina Tan, infectious disease specialist over at Lurie Children's Hospital. We appreciate your time.
Thank you very much.
Thank you. A suburban district now investigating